Hi folks, Mayor Kevin Davis from my kitchen table. A couple things I want to talk about tonight. One is our transit service. We now are using the back doors. The front part of the bus will not be occupied. That's to protect the driver. And because you're coming through the back door, there's no way to collect fares. So in effect, it's free. But we're asking people, please do not joyride to take a bus to get around the city for enjoyment, because the bus service is there primarily to assist those who have essential employment and have to get to their jobs. The capacity of the buses are 1/4 of what they were, because the front half is roped off. The back half is at half capacity because of social distancing. So please do not use the transit service unless you absolutely have to. Another great initiative we started today, and this is about the volunteer program we've been talking about for some time now. Staff have been working on this, recreation staff, under the direction of Lori Dawn Cavan, and they've come up with a great arrangement doing 4 things: sharing available resources, encouraging donations, neighborhood associations helping neighbors, and connecting volunteers to those in need. Find out more, go to brantford.ca/neighbors helping neighbors for more information. A great program. Last I want to talk about, I talked a little bit about this yesterday, the importance of social distancing, washing your hands, etc. It's all about, we hear, flattening the curve. And I wanted to show you with this whiteboard what that's about. And it's based, this is not scientific, but it gives you the general trend lines. So with the coronavirus, I think it's for every 1 person that's infected, they pass the virus on to 2 others. So, but it doesn't increase like one by one. It can increase and spread through community very fast. And this is an example here. You say if you have 1 case and sometime after, maybe it's a week later, whatever, 1 makes 2. And then the next step, these 2 infect 2, so it doubles, goes to 4. Then the next step goes to 8, and it's doubling, 16 and 32 cases. And in this example, at the very last time period, the numbers double. And this is what puts a tremendous strain on a hospital, is this rapid increase towards the end of a spread of a virus, whether it's a cold or flu or whatever. And then of course it does tail off at some point. The flattening is intended to change that. It's intended to spread out the time between the stages and have the curve flatten out at a much lower level. And so what does that do? It buys time. It buys time. There's a number of scientists across the world looking at using currently available drugs to come up with a combination that can be used to effectively treat this disease. And this flattening of the curve gives time for that to happen. Plus, you can see in terms of how the cases progress, this is a much more tolerable load for a hospital than this. So this is why you're being asked to flatten the curve, doing whatever you can to socially isolate, making the staying home, not going out unless you absolutely have to. If you have to go outside, then of course maintaining that distance of 62 meters. And of course those who are returning from international travel, it's now the law, you have to remain isolated, which means in your home. You're not to go out of your home. You're not to have your friends and relatives visit you in your home. It means isolated in your home 14 days.